Hi, everyone. It's Angie. Hope you're having a wonderful Tuesday. So as promised, I wanted to start this series on GLP-1s today. There's a lot of information to cover, so I figured this presentation type style would be good so that those of you that are visual people can see and you can hear as well. So there's a lot of information, like I said, to cover. So if you have any questions that I did not mention or anything that is personal to you, you can always message me. You can come in for a consultation and we can talk about it. All right, so let's get started we're going to start with Ozempic and Wegovy today. So we've been talking about GLP-1s. What the heck is that? It is a glucagon-like peptide. So this is a hormone that your body naturally releases after you eat. And semaglutide, which is the generic of Wegovy and Ozempic, this is kind of like a synthetic version of that. And it acts like that natural hormone, but it lasts much longer in your body. That gives you the effect of feeling fuller quicker, staying fuller longer, and helps your body handle sugar better. So that's basically what a GLP-1 receptor agonist is. Okay. So let's talk about some similarities between Wegovy and Ozempic. Like I mentioned before, they do have the same active ingredient, which is semaglutide. So essentially, they should work the same way. They have the same route. The two options that are available are the injectables and the oral pills. Now, since it's the same medication, you will likely have some of the same side effects. So just be aware of that. Okay, so the differences here are what's important, and especially when it comes to getting insurance coverage for these medications. So with Ozempic, it is indicated for type 2 diabetes, really. And then another thing that's important is compared to Wegovy, the maximum dose for Ozempic is a little lower at 2 milligrams. And we sometimes refer to that as the maintenance dose. So with Wegovy, on the other hand, it is indicated for obesity and weight management. I include weight management because the insurance companies get very specific about qualifications. So you can still qualify even if you're not obese. And I'll get into that later as we talk about more on Wegovy. So Novo Nordisk, which is the creators of Wegovy and Ozempic, they recently released a high-dose Wegovy injectable that goes up to 7.2 milligrams. And the pills go up now to 25 milligrams. I think they were about 9 before. So for those people who have plateaued on the maintenance dose, which was 2.4 before, there's additional options now with Wegovy, with the injectable and with the pill. So I mentioned that Ozempic is indicated for type 2 diabetes, but what I want to really drive home and counsel my patients about is that the medication is great by itself, yes, but it is to be used as an adjunct to diet and exercise. This will really help to improve your glycemic control and your overall diabetes, and just help the medication give you the best results. It is also indicated to reduce the risk of major cardiovascular events, so like stroke, heart attacks, as well as lowering your A1C, lowering your lipid levels. So if it's taken as prescribed, if it's used as an adjunct to diet and exercise, you will get the best effects from the medication. So with Wegovy, it's indicated for obesity, like I mentioned. So that's patients that have a BMI greater than or equal to 30. That is an automatic qualification. You should not have an issue getting your insurance company to approve Wegovy. However, patients who are considered overweight, that's a BMI greater than or equal to 27, that have a documented comorbidity like hypertension, high cholesterol, or pre-diabetes, you can also qualify. Again, that has to be documented. Your doctor have to have some type of note and diagnosis code that coincides with these comorbidities, and you can get qualified for that medication as well. Again, it's the same generic medication, so it also has that same risk reduction on cardiovascular effects. Um, it's also indicated for people with NASH or MASH, which is basically just liver disease or fatty liver that's not caused by alcohol. And then one last thing I wanted to mention, I wanted to touch on that I don't think many people know, and that is that Wegovy can be used in the pediatric population. So as young as 12 years old, if they have that obesity diagnosis, or if they are overweight with one of these comorbidities, they can qualify for Wegovy, not Ozempic, Wegovy. Okay, so this is an important slide. Let's talk about the contraindications. So the first one is personal family history of medullary thyroid carcinoma, MTC. So in the clinical trials they did with rodents, the researchers found some increases in thyroid C-cell tumors, and it's unknown if that actually happens in humans. They did not do a trial in humans, so it remains a black box warning nonetheless. So if you have a family history of that, you are not a candidate for Wegovy or Ozempic. There's no routine screening that we do, but if a patient have a neck mass, you have difficulty swallowing, you have persistent hoarseness, any other symptoms that raise a red flag, your provider should do further investigation before starting you on any of these medications. Thyroid conditions I want to mention. So if you have hypothyroidism, hyperthyroidism, Hashimoto's disease, these are not contraindications. So don't be alarmed if you have a diagnosis of that. We will just continue to do close monitoring, but it's not a contraindication. If you have a history of pancreatitis, this is not necessarily a hardcore contraindication. I would just say it's more of a precaution, and your provider should be doing close monitoring. It just requires careful clinical judgment. So again, you're not disqualified automatically if you have a history of pancreatitis, but we just definitely want to pay more closer attention to it. Pregnancy, of course. Why would you want to take this medication while you're pregnant? So I'm not even going to touch on that even more. What else? Of course, if you're allergic to any of the ingredients in the medication, specifically semaglutide, you should not take this medication. And then one more thing I wanted to touch on is breastfeeding. So the clinical trials, they found SNAC. It's SNAC, which is the abbreviation for the ingredient in the pills, the absorption enhancer of the pills. They found that in breast milk. So the pills are not recommended or is contraindicated for women that are breastfeeding. However, with the injectables, that they don't have the absorption enhancer, that SNAC aspect to it. And in the clinical trials that they did, the semaglutide was below the lower limit of concern in breast milk. So no for pills, yes, with caution, I would say, with the injectables. And side effects. So some of the most common side effects that patients complain about, that they have concerns about, are GI issues, gastrointestinal issues. So nausea, vomiting, diarrhea, constipation, GERD. So honestly, I feel like a lot of these can be managed at home, can be prevented even. So take, for instance, GERD. Everything that you would have done to prevent it, like making dietary modifications, so staying away from spicy foods, chocolate, alcohol, things that would trigger GERD, laying down 30 minutes to an hour, actually not laying down 30 minutes to an hour after eating, just giving that food the time to go down and digest. These things, you can do at home. Of course, if you're doing all of that at home and it's not helping, we do have medications to help with GERD, nausea, vomiting. Water intake is also very, very important. This medication will dry you up. So you definitely need to increase that water intake. That'll help with the constipation. You can even start taking preemptively a stool softener over the counter. Just take a stool softener just to keep you regular. It'll help with headaches, to decrease headaches, because dehydration will definitely give you a headache. And then, of course, decreasing your appetite, that's kind of just what the medication does. So you kind of maybe have to remind yourself to eat smaller meals, more frequent meals, but smaller, to prevent having that GERD or having nausea, vomiting. Another big thing I find, when the medication makes you feel fuller faster, the people tend to push that. They still eat even when they feel full, and that will trigger some nausea and vomiting, right away. So when you feel full, that's your body telling you to stop. Okay, so stop. All right, so another important slide. Serious adverse effects. You need to seek medical care as soon as possible if you experience any severe, constant epigastric, so like upper abdominal pain or left upper quadrant pain. If it radiates to your back, to your chest, your flanks, if you're having any systemic symptoms like fever, tachycardia, you're breathing fast, you just feel like crap, that can be an indication or symptoms of acute pancreatitis. So that is a medical emergency. You need to seek medical care as soon as possible. What else? Gallbladder disease, that usually happens when you have rapid weight loss. So I tell my patients 1 to 2 pounds a week is like ideal. That is amazing. I don't want you losing like 20 pounds a week. That is just crazy. You are destined to have some gallbladder problems. So don't push it. Don't try to, rush the medication. Seek your doctor's advice. Heed to your doctor's advice so that you don't end up with these complications. What else? Acute kidney injury. That's what AKI means. That mostly happens due to dehydration. So again, I mentioned in the previous slide, water is so important. So increase your water intake as much as you can. What else? We have hypoglycemia. That happens, usually I see that happen with patients that are taking concurrent insulin or other medications that drop your sugar like glipizide or glimepiride. So if you are taking these medications and your doctor is talking to you about adding on a GLP-1, they should be having the conversation with you to adjust some of these medications, lower the doses, so that decreases your chance of having a hypoglycemic event. So I had a question someone asked about hair loss and bone loss. A couple of people asked about that. So I just wanted to put that on there and just cover that really quickly. So in one of the clinical trials, they found that only 3% of people experienced hair loss. And that was only at the highest, the maintenance dose at the time, 2.4 milligrams. That could be likely due to many reasons. It could be these physiological stress of losing so much weight. It could be a micronutrient deficiency, especially because people don't tend to eat as much. They lack protein, zinc, biotin, all these nutrients that are essential for hair growth. So it does not really, the medication does not really directly cause hair loss. I think it's a multifaceted thing. So I would say, you can, again, preemptively start taking, micronutrients, biotin, things like that to help with your hair. I like Nutrafol. You can look it up, Nutrafol. Look that up. That's really good for hair. And then lastly, with the bone loss, I do find that people ask that question a lot. Think of it like this. When people lose weight, they can lose both their bone strength. Your bones are kind of like a structure that gets stronger as it carries more weight. So when you lose weight, there's less load on the bones, and then they tend to become thinner over time. So the medication itself does not directly damage bones. It's the effect of the weight loss. So we can protect the bones with strength training. You can do supplementation with vitamin D and calcium. Just make sure you're at those optimal levels. And of course, increasing your protein intake as well. Okay, so let's talk about the dosing of Ozempic really quickly. Um, this is the dosing for the trademarked Ozempic, not the compounded versions of semaglutide, as I know some of that can differ with doses. So to start with the injectable doses that Ozempic offer, they start at 0.25 milligrams and go up to 2 milligrams. Now, just be aware we don't expect any weight loss at 0.25 milligrams. If you do lose weight during that first 4 weeks, that's amazing. But this is just an introductory dose to have your body adjust to the medication. The injectables are injected weekly on the same day, and typically we will increase that dose at 4 weeks when you do a follow-up. So we can see how you're doing on medication. I tend not to always increase. So don't think that every time you come to a follow, we're going to increase and go to the next dose. If you don't see any changes, if you plateau at a dose, then we can talk about increasing. But if you're losing weight consistently every week on a dose, there's no reason that we need to increase the dose. So you want to really maximize and max out on a dose before you increase that dose. There are the pills options. There are 3 options of that. It starts at 1.5 milligrams. There's 4, and then there's 9. The pills have very specific instructions that has to be followed. So it's taken daily. You have to take it whole with about no more, I would say, of 4 ounces of water. So you don't crush it, you don't chew it, you don't break it, you don't take it with applesauce. It's very, very important as it will decrease the efficacy of the medication. And another important point is you must wait 30 minutes before eating anything else or drinking anything else or even taking any other medications. And lastly, I would say if you miss a pill, don't take 2 pills. You just have to take 1 pill the next day. So if you miss a pill, it's gone, that's it, just throw it out, whatever you want to do with it. So those 2 options, it's a conversation to have with your provider to determine which one is best for you based on, if you're afraid of needles or if you're not a pill popper, like to have a conversation with your doctor and see which option is best for you. And with Wegovy, there's a few more doses that we get to titrate to. So previously, as I mentioned, the highest dose was 2.4. That was the maintenance dose. But they have since come out with Wegovy HD, Wegovy high dose, which is 7.2 of the injectable version and 25 milligrams of the oral pills. The pills follow the same administration rules. Everything I mentioned before about Ozempic pills, that still stands. All right, so that was the first series, part 1 of GLP-1s. Next week, I will talk about Mounjaro and Zepbound. The following week, I'll kind of all tie it together. We'll talk about compounded versions. So stay tuned. If you have any questions that I did not cover about Wegovy or Ozempic, please feel free to message me, comment, email me, call me, go on the website and book a consultation, whatever you need. I am here for you to answer your questions. Have a wonderful day. Thank you. Bye.